my name's Ed Benjamins. I work for Lakewood Health Plan, and we work really closely with the hospital. And I'm here today to give you guys a little bit of insight into how healthcare works. I know you guys hear about it in the news all the time. It's really a huge political topic. We spend about a third of all the money that we generate in this country on healthcare, and hopefully there's a healthcare career for some of you in the room. And so I want to talk to you a little bit about what some of the options may be for you in healthcare. What are some of the things you need to know about as you guys graduate, because you guys are all going on fairly soon here to graduate. And maybe some information you can take back to your family about how healthcare works and what you need to think about when you're choosing healthcare. Okay? From early on, your whole life are going to need healthcare. Okay? When you come into this world and when you go out. And everywhere in between. I bet this knot on the head represents at least 85% of you in here. Whether you are a little guy in the beginning of your life or an older guy later in life, you're going to need health care. Okay? And maybe it's not going to be a knot on your head. Maybe you'll almost cut something off. And you can only imagine how much that hurts. So healthcare has two ways that it comes to you, or that you get it. It's either public or private. Okay? Here are some of the public ways that healthcare is delivered to you. There's Medicare. Have you guys heard of Medicare? Medicare, Medi-Cal, Healthy Families. Then the other three, probably not as prevalent, is Veterans Administration, the VA. Have you guys heard of that? And then Indian Health Services and Federal Employee Health Benefits. So those are public ways that healthcare is delivered. So Medi-Cal is run by the state, and it is for members of the community that are at a certain level of the poverty level. Okay, so in Medi-Cal, you get government funding in order to access or for somebody to insure you for health care. Okay, it's administered by the state, and the way it works is the state, through taxes, puts up money to fund Medi-Cal, and then the federal government matches a certain portion of it. Healthy Families is a very similar thing, and it's for kids primarily who are above, whose families' incomes are above the Medi-Cal qualifying level, but they still don't quite make enough in order to pay for their own health insurance. You guys, there's a big VA hospital down on 7th Street by Cal State Long Beach, and this is primarily for people in the military who are either in the military actively or who have been in the military. Okay, Indian Health Services, one of the things that the federal government does is they fund a number of hospitals and clinics throughout the nation and Alaska for providing healthcare services to Native Americans. And then the network that they have is they have 33 hospitals, 59 health centers, and then 50 health stations. Okay. So when you have health insurance that you're choosing through your employer, when you pick, there's two types of networks that you can choose from. There's an open network, which is an open and preferred network, or there's a closed network. But this is how it works. When you go to a health plan, when you work and you choose a health plan contracts directly with either an employer or the government. All right, so each of those health plans, they contract directly with either an employer, like a big employer group, like the teachers or the school district or Boeing or one of the big employers, or they contract with the government. And what they do is they create a benefit, and that benefit is, okay, patients who come to us will have a $10 copayment to see the doctor, a $20 copayment when they go to the emergency room. We'll provide them with infertility benefits, catastrophic care. So that's kind of how they pick the benefit. Sometimes it's $5 copay, sometimes it's $10 copay. And the medical group is a group of physicians who come together and say, we will take care of all of our patients, or all of these patients through the health insurance. We'll take care of all of their professional needs, okay? So, and all their diagnostic needs. So every doctor that they need to see, we'll take care of it. Every diagnostic test they need to have, we'll take care of that. So if you go to you go have an x-ray done, then the medical group is the one that kind of manages that. Okay? All right, so when you have this open or preferred network, then here's some of the ones that are open or preferred. If you have Medicare, which is for seniors, fee-for-service Medicare, which is you have a card for Medicare, and the government, the federal government, pays for all of your health care. But what happens with this fee-for-service, you can go anywhere you want, but you have to pay 20% of the bill. And so it costs you a lot to do an open network through Medicare. In a closed network, like there's a whole program called Medicare Advantage. So about 20% of all of the seniors in the country, they trade in their Medicare and they sign up for a health plan. So instead of going anywhere they want and paying 20%, they go to where the group says they need to go and they don't pay anything. Or you have like an HMO, okay, which is a health maintenance organization. And so what they try to do in any health plan is they get a premium, and this is how insurance works. You get a premium, and then you have cost. And as long as you get more money in your premiums than you have in your cost, then you have a profit. And that's the same in health insurance, car insurance, homeowners insurance, any insurance company. And that's what they try to manage. So they take in a premium, and they try and spend less than they take in. Okay? So, and then usually there's about a 5% left over that goes towards future debt or profit for the health insurance company. So it's a pool of money that's allocated for certain services that, if not spent in its entirety, is split between those people who are in the risk pool. So you have a health plan that puts $300 a month into a bucket for professional services. The medical group and the health plan are in the risk pool together. If they only spend $200, then they get to split the $100 savings together. Okay, that is the driving force behind risk pools in healthcare. When the medical group and hospitals work together in a risk pool, if they work together, then they can save money. What's happened a lot of times is they don't work together. And instead of working together, they work against each other. And that happens in healthcare, it happens everywhere. So we threw this in here because we want to just give you a little bit of heads up. And that is your health. Because one of the things that developmentally we all go through is we have this thing, and it's called the indestructible self. And we have a self-image that we're going to live forever, and we don't have to worry about getting old or dying or whatever. And some, like me, still have that concept. But if you want to live longer, then there's three things that you need to consider. Number one, in every book you will read is smoking. Okay? Smoking, if you're the average male, if you're a smoker, you'll die 13 years sooner than somebody who doesn't smoke. Okay, that's on average. If you're a female, 14 and a half years. So if you smoke, you'll die 14 years sooner than somebody who doesn't. Okay? It is the biggest factor that affects longevity. Next, obesity. Okay? If you're obese, you will die 7 years before, on average, somebody who's not obese. 20% of all cancers, deaths are related to obesity. You will have, as an obese person, you will have 30 to 50% more medical complications than somebody who's not obese. Okay? And the problem is, 65% of all adults are obese. This is really a small slide, but I want to show you, these are a few positions, how many years it takes after school, and what kind of salary range that profession makes. So, an audiologist. Can somebody tell me what part of the body an audiologist works on? Ears. Ears, that's right. An audiologist is somebody. And it's 8 years after school, high school, on average. Cardiovascular tech, 2 years after school. The good thing is, have you guys heard of Obamacare? No. Okay. So we, as a country, are trying to rewrite the healthcare system. And part of what we're doing is we need more healthcare professionals. So there is now more grant money for you to go to college to do healthcare careers than there has ever been before. So if you are, like I was, somebody who really needed grant money and scholarship money to get through college, then a career in healthcare, there's much more funding out there for you. For those of you who are interested in careers, I have a binder, and I'll make sure it gets to them, that goes through every career in healthcare, what the training is, some of the things that you need to consider in that profession, and then what the salary grades are for each one of those professions. So if you are going to choose healthcare, you got to look at certain things. Find out what training's involved. Narrow your field. Don't say you're going to do everything in healthcare. Pick one. Okay, the other thing you got to think of is, what's the job market look like? How many openings are out there? If you're picking a profession that when you look through the want ads, there are no positions available, it's going to be tough to get a job in that. What you have to do to get ready: start early. Know what's important to you. Also, understand your skills. And when you decide, make sure that your skills and talents are kept in check. Review the schools that have those programs, okay? The other thing that you need to consider, and something we're working on with your career department, is job shadowing, okay? Find out about the job. Just because it pays a lot of money doesn't mean that it's a job that you're gonna want. You have to love what you do, and you're gonna do it for a long time. So try it out. Look at job shadowing either through the career program and one that we're trying to set up, or try and make arrangements for to find out more about a job and being there. Don't just pick one school. If you're going to pick a school, pick 3 or 5 schools. You put all your eggs into one school and you don't get in, and you have no backup plan, it sets you behind. Okay? You don't want to lose a year because you didn't get accepted to a school. Okay, contact the student affairs office at the school once you get selected to help with your transition. And use your guidance counselor. Okay, they really know what they're doing. They can help you.